All right, folks, we're back now with Dr. Darien, taking a look at a new report that suggests that the U.S. is facing a maternity care crisis, with 1 in 3 counties lacking OBs to provide care. Tell us about it.
Some pretty concerning statistics reported from the March of Dimes. This comes after the debate last night where access to reproductive care was one of those important topics on every person's mind. These studies show that one third of counties do not have an OBGYN. That is estimated 35% of the counties in this country where women have to travel miles to be able to get care. OBGYNs deliver up to 85% of the babies in this country, aside from doulas and midwives, so it's an incredibly concerning statistic. In some of these states, it's the highest numbers. North Dakota, for example, more than 70% of their counties do not have an actionable OB. Oklahoma, Missouri, Nebraska, Arkansas, more than 50% of their counties do not have an OBGYN. And when we look at this data and the trends that we've been seeing, it has been occurring since before the overturning of Roe v. Wade, but it's gotten worse, unfortunately, as many OBs do not want to practice in states where appropriate care of patients might become a criminal offense.
As a woman who had a baby, you had to go to the doctor like all the time. So then what happens to these women if they're not getting those like monthly checkups, basically?
We see worse outcomes. We see higher rates of maternal mortality, mothers dying during their birth, higher rates of pediatric babies dying during their births, and many people need to understand the risk factors. Number one, things like understanding the warning signs, but also knowing your options. OBGYNs are a large part of delivering babies, but also, as I stated, doulas, midwives are also shown to be associated with improved outcomes with mothers and their babies. So reaching out to those providers, family medicine providers, and also just being aware and politically active in your town, in your county, in your state, if this is something that matters to you.
It is definitely something that needs to be fixed ASAP.
Absolutely.
Doc, thank you very much. We appreciate it.